What needs to be done to lower the cost of health care? Explained by Tom, Dick, and Harry. There has been much debate over the last few months with respect to changing the American healthcare system. The primary focus has been on health insurance, but health insurance is merely a system of making the payments for services provided. Other than negotiating costs with providers, it does little to actually affect the real cost of health care. Health insurance, like other insurance, including car and life insurance, is a financial service, with the expectation that many will pay into the system and only a few will take out funds from the system. In the case of car insurance, many will pay for car insurance, but few will file claims. The monies collected are invested with the hope that the firm will earn interest on the fund. The fund pays out money for insured instances, like car accidents. It pays out expenses related to maintaining the service, such as labor of administrating the fund, and at the end there is an expectation of making a profit. In the case of health insurers, they usually enjoy a 3 to 5% profit margin. The healthcare industry, like all others, has expenses in running their operations: labor, buildings, energy costs, even insurance and legal expenses. That means any increase in the cost of running a healthcare clinic would raise the cost of the services to consumers. If the cost of rubber gloves and bandages goes up because of taxes, the clinic would pass the cost along just to break even or make a small profit. If the cost of energy goes up, so will the cost of healthcare. Harry knows this simple economic fact because the cost of almost every product and service is influenced by the cost of energy. So no matter what system you prefer, private health insurance, a public option, or no insurance at all, the only way to provide lower health care costs to the American public will require lowering the expenses of providing those services. That means that doctors will need to see more patients, and Dick has an idea on how this can be done. One way is through the use of staffing and technology. This way would require people to spend most of the time with physicians' assistants and nurses instead of medical doctors. Kind of like the military's medical service. Corpsmen and medics provide the bulk of medical care under the guidance of a few doctors. These caregivers are highly trained and motivated to care for their patients. The use of technology by having a doctor at a command center, observing and answering questions from many caregivers, located at clinics, and satellite clinics in places like drugstores, supermarkets, and shopping malls, in addition to easy access to databases matching the patient's medical record with medical libraries and the patient's chart, can help the caregivers come to a quick diagnosis and treatment. One way the government can help in lowering the cost of healthcare is to ensure that no taxes are applied to any expenses of a medical organization. Another area in reducing the cost of healthcare involves legal liability. That means that there must be caps placed on claims based on proven medical errors. This could be handled by an arbitration system that would have a clear defined list of approved awards for proven medical damages and approved fees for the arbitrator and lawyers handling the case. This would help lower the cost of medical malpractice insurance, judgments paid out by medical organizations, and will reduce the need for cover-your-ass medicine, which is the practice of doctors ordering tests and sometimes even procedures that may not be needed in order to give them an added defense in the case of a lawsuit. Another step to lowering the cost of healthcare would be for organizations such as for-profit companies and not-for-profit organizations like churches to open hospitals and charge much less for the same services offered at other hospitals. If the medical industry is not assisted with external factors such as energy costs, legal and insurance costs, and redefining the qualifications of caregivers, we will not see a reduction in the cost of healthcare. Likewise, to see a dramatic reduction in the real cost of healthcare, we must see true competition enter the marketplace, not just with insurance, but with providers of healthcare. That means that for-profit corporations like Walmart, CVS, Costco, and Walgreens may need to enter the consumer healthcare market by offering more services at the same level and at a lower cost than current providers, maybe even by opening small hospitals. Not-for-profits, like churches, could help out by starting competitive hospitals as well. Only if external costs are lowered and the marketplace forces the healthcare industry to find ways to provide care at a lower price will we see the cost of healthcare decrease.